Hi friends, good evening. I'm Dr. Ashutosh Gupta. And whenever we talk about fetal skeletal dysplasia, so whenever we are doing those ultrasounds and we are suspecting some skeletal dysplasias, we really try to identify the lethal and the non-lethal skeletal dysplasias, right? So just for an overview, lethal skeletal dysplasias are of six varieties. So this could be thanatophoric dysplasia. Why we are talking about it? Because it is the commonest one. Okay, so TD type 1, TD type 2. Then we can have an homozygous achondroplasia, heterozygous achondroplasia. We can have a polydactyly, and therefore we can have a short rib polydactyly syndrome, or we can have an ATD, which is called a Junan or an expecting thoracic dystrophy, and camptomilic dysplasia, right? So let us just talk briefly about all these things. TD type 1 is one of the commonest. I do a lot of videos across, but probably I'm going to post one also. So it is usually have a telephone receiver femur and all those stuff, right? So very severe micromelia and a telephone receiver femur. TD type 2 usually have a craniosynostosis and therefore we do a clover lip skull. And achondroplasias, which is in homozygous, we do have a micromelia plus some sort of a midface hypoplasia and frontal bossing. Now, osteogenesis imperfecta type 2 and type 3, we can have a beaded sort of in ribs and long bones because we do have an antenatal fractures. And short rib polydyactyly syndrome, I must have posted a video of this thing. It was a bell-shaped chest and all those stuff, and therefore it is called as an SRP, which is called a short rib polydyactyly syndrome, and an ATD, associated thoracic dystrophy. So now today we are going to talk about how does this mid-face hypoplasia and frontal bossing looks like. It is really very interesting to see this feature of this, which is very common for achondroplasia. Right. So let us go through these slides and then we'll talk about. Look closely. This is at 17 weeks. Right. Mid-face hypoplasia. So this is mid-face hypoplasia and frontal bossing. So it is very classical for it. For a very long time, I've been really looking around for this thing. So this is a macrocephaly, the macrocrania, macrocephaly, midface hypoplasia. We can see the nasal bone even upper lower jaw, but then this is and then we identify the limbs, and therefore these are micromelia, right? So this could be achondroplasias. Lethal skeletal dysplasias are usually autosomal dominant and they are driven by the advanced paternal age. So the mutation is there in the sperms. So that can happen spontaneously and because of the advanced paternal age that can happen. पहला दूसरा we try to identify what exactly that we are dealing with and therefore we can really help them with the diagnosis and the risk of recurrence. But usually all these things are autosomal dominant, whether it is FGFR2 or FGFR2, FGFR3 or FGFR2, whether we talk about TD type 1 or TD type 2 or in achondroplasia. So this looks like to be in homozygous achondroplasia. So we are dealing with a macromelia, we are dealing with the frontal bossing, midface hypoplasia and a macrocrania. So this fits into this homozygous achondroplasia, right? And then we also identify that this is the mutation is almost the single mutation and then it gets repeated. So what we can offer them is this, that we can do an amniocentesis and look around for the same mutation so that it will confirm the diagnosis and therefore would help us in a risk of recurrence. Why we're talking about all these things is this, that we need to differentiate, right? Okay, between thanatophoric dysplasia type 1, in which we would have a telephone receiver femur, we would have an bell shaped chest, and therefore a bell shape जो मंदिर की घंटी होती है उस तरह से, so we can have a bell shaped chest. So the basic premise is a pulmonary hypoplasia and therefore we can have two differential diagnoses which is called as SRP, short rib polydactyly syndrome, and an ATD. In ATD we would have a polydactyly even, right? And the third thing is the midface hypoplasia, frontal bossing and micromelia. So this goes in favor of being achondroplasia, so homozygous being first as compared to the heterozygous. And and the fourth one is, as I've told you earlier also, so we can have fractures in the long bones, basically in the ribs also as well as in the long bones, and therefore we can have osteogenesis imperfecta, which is called as an OI type 2 and type 3, right? So this is midface hypoplasia and supposedly homozygous achondroplasia, right? Thank you very much for your patience.